I'm using a series of posters to talk about infectious claw diseases, particularly digital dermatitis and lameness prevention in cattle. This could apply to dairy cattle as well as beef cattle if you wanted to, but since the robotic and automated milking systems are so en vogue, such a hype, there are several hints that I would like to give you in order to deal with prevention and control of claw diseases, particularly digital dermatitis, in robotic milking systems, because some things are a little different. So among the different posters that I'm going to be working with, there's this one about robotic milking and digital dermatitis. When we talk about infectious claw diseases in relation to dairy cattle, we think about foot rot, so with interdigital phlegmones. We think about interdigital dermatitis, which is one of the historically described diseases within an infection inflammation of the interdigital space. So I see Jan Hendrik back in the waiting room. Hello, Pookie. And I want to emphasize that these different claw diseases, they somehow make connections. And if they go in undetected, which is often the case in these robotic milking farms, then you see how they start interacting a lot and then producing horn damage and dysfunctional horn that will lead to mechanically induced conditions that then lead to long-term lameness and severe lameness and financial losses in terms of animal well-being, cow well-being, longevity, and so forth. So what is this about robotic milking farms and digital dermatitis and lameness in general? And it has a lot to do with the setup. And setup in terms of how are footbaths being set up and used in robotic milking farms? How are setups in terms of the walking direction, the walking speed, and the ease of management of cows in waiting areas around the robotic milking facilities? How are the gates functioning? What type of steps are around there? And how is the stockmanship in terms of herding cattle in and around robots? How is that happening? So focusing in a little bit more, if you think about footbaths and robotic milking farms, then disinfecting footbaths need a setup. They need a trough. If you see a brand new trough sitting somewhere leaning against a wall and it has never been used, then it may have a setup, but not a good setup because it's not being used. You have to think about worker safety because robotic milking farms often have a lot of gates to guide traffic of cows. And that has implications for the safety of dealing with the disinfecting solutions that you are using on those cows' feet, for the purpose of disinfection. And so how to deal safely with highly concentrated disinfectants that have to be transported from an outside area of the cows towards an inside area there. And this leads us to the topic of automated footbathing systems that are often much shorter compared to the 10, 12 feet length that we recommend. They often need more or less fluid compared to what the conventional footbathing troughs do. They often have to be monitored, particularly in terms of functioning. Since they are often automated, if you don't monitor their proper functioning, you may have a setup for a footbath that is not functional in the end, or has the wrong concentrations, the wrong frequency, does not empty well, does not fill well. So they need a little bit more surveillance and maintenance compared to the conventional footbath that you set at a certain time point into a certain location, and then you remove it afterwards, or you bar the cows from entering it. There are indications as to the construction and the setup of the automatic milking systems that have high implications for foot health and lameness prevention. If you think about the steps and the very narrow turns that cows make when entering or exiting from milking robots, that has huge implications for claw health and lameness prevention. So whatever we do in order to soften the impact that the claws have upon exiting this robot, taking that step down onto a slatted floor, this is worthwhile our thinking and our time in order to prevent lameness, because the mechanical impact on the foot upon making that step, particularly if it's in a hurried way, out of a panic or in an anxious situation, it has consequences for the cows. Then there are indications as to how cows are interacting with the system, and that is how much time are they spending in the waiting room, and while they're waiting in those rooms, what are the other cows in terms of hierarchies of the system or of the group? What are the hierarchies that these cows are interacting with? And this is particularly of interest when you talk about heifers that have been introduced recently into the lactating herd. If you confine cattle to long time waiting periods in front of the robotic milkers, this can have huge impacts on the lameness. And for example, setting up cameras in this area just to monitor and to sum up the time budget and the time length and duration that these cows spend in these waiting areas is worth your time, because they on average spend longer periods of time than we ever think. In this particular herd, which is an example, cows were spending up to 8 hours at night just waiting to go into the robot. And they were circling on this hard concrete floor without any resting, without any feeding, any access to water and nothing. So the cow comfort in these waiting areas, when waiting periods are long, and they must never be 8 hours long, they are important when it comes to preventing lameness. Another aspect of this prevention of lameness and claw diseases in robotic milking farms is the setup and the condition of the flooring. Very often the AMS farms are relatively new, unless they're retrofitted, of course, but new in terms of using surfaces. And particularly if the surfaces, the walking surfaces, have grooves and slats that are perpendicular to the walking direction of the cows. Whenever cows are being hurried across these surfaces, walking, running, braking, making sudden turns, this has impact on the mechanical quality of the horn. Think about bruising, white line diseases, increased abrasion, toe tip necrosis. So the younger the flooring, the more impact it has on cows' feet and horn conditions if you let them circle around this for a long period of time. We're going to talk about the skid marks that the cows leave and using those as signals as to how they're doing on these floors. We're going to talk about abrasion points and the consequences for the mechanical injuries and impact upon these cows. We're going to talk about what do the digital dermatitis lesions look like in a robotic milking farm where nobody's looking, and what are the prospects for artificial intelligence to help you with cameras and to help you out with systems that can detect these lesions automatically. So this as introduction, and what can this look like now? Here's my overview of the poster. Think about automated foot bathing. Very often these troughs are relatively narrow. They have these side wings. There's a discussion about where to position a foot bath in general in relationship to the automated milkers. And we say it could be either at the exit of the robotic milker in kind of a curved path so that they have to walk through, but not immediately after the robotic milker, but rather at a certain distance so that the cows do not associate it being milked with having to go through a foot bath, which might be causing anxiety. You have to make sure that the mixers, here you see an example of one of these automated mixers, that they have good water access with water clocks to measure the exact amount of water that goes into such a mixing tub so that the concentration is consistent and is what you actually determine it to be. And that includes the pH. This is my general talk about how to initiate a well-designed foot bathing program. But the pH of, for example, a copper sulfate foot bathing solution should not be lower than 3. And the selling point of having extremely acid pHs in copper sulfate foot baths, I think, is not reasonable. You don't need these extremely acid pHs in order to have copper sulfate in total solution and being dissolved as a salt. Actually, at 25 degrees Celsius, a copper sulfate salt dissolves completely, dissociates completely into the Cu2 plus and SO4 ions, and like this develops its disinfecting action. And that happens already with 95% plus efficiency at 25 degrees Celsius and a pH of 3. So you don't need extremely acid pHs in these foot baths. Think about frequency, and then there's always the question, so how many cows can go through one filling of such a foot bath? And I'm going to talk a little bit more about this, and that is to say, you can withstand, actually, let me make this bigger, you can withstand with 150 to 300 cow passes before you refresh this foot bath, and it depends on the hygiene of the lower legs of these cattle that do walk through a foot bath. And actually, we offer a service here in my lab in Wisconsin, and that will hold for the US actually. If you want to check out how many cows you can let walk through your foot bath, you sample these foot baths at 0, 50, 100, 150 and so forth cows, and you send the samples overnight, so ship them overnight to my lab. We culture them, and we can tell you or advise you about how many cows you can afford to have walking through the same foot bathing fluid in order to have still a good disinfecting action. So, well-maintained mixing facilities, well-maintained drainage of these automated foot baths, the positioning either close in a curved path exiting the milker, or far away, way away from the robotic milker, which is when you have to have people herd cattle through foot baths. At the same time, what I've observed often in automated, also in AMS farms, is the floor hygiene and the leg hygiene may not be optimal. And since people are not walking and seeing the cattle at every milking, there are many conditions of leg hygiene, of claw health that go unnoticed. Not every foot looks like this one, where the skin horn border is very clear, very clean. You have this sharp shape of the inverted V here at the exit of the interdigital space, not hinting at an infectious claw disease. What you do see here is a relatively low heel. So another aspect of what needs to be looked after in any dairy and beef cattle system actually is proper hoof trimming that spares the heel height of the horn to the point where there is sufficient heel height. Because if I am a cow and I have low heel height here and I'm walking on irregular surfaces and I'm making sharp turns, that leads to an overextension, or easily leads to overextension of the interdigital skin, associated with microtrauma of that interdigital skin, and that would become the port of entry for microbes that are associated with foot rot, with digital dermatitis, interdigital dermatitis, and that's not a good thing to have. So what do I like to see, or what do I actually see in robotic milking farms that I don't like so much, are lesions that are never recognized as such because there's no one looking. So you find these digital dermatitis lesions, this is an acute active lesion if you clean it down, that have never been seen before. So there's a total underestimation as to the prevalence of infectious claw diseases, among which digital dermatitis. And there is a degree of chronicity. Here you see a digital dermatitis lesion that is actually active and acute, but then there's all this debris around it. This is very typical for AMS farms, not exclusively typical, but robotic milking farms have a lot of this. So I would encourage anyone involved with digital dermatitis prevention in robotic milking farms to be on the lookout for lesions. And actually we have a computer vision system where we set up cameras in the back of milking robots or at the exit of milking robots, but close to the antennas that identify the cattle. And we can recognize these lesions and flag the cows like, whoa, there's a lesion here. You need to pull this cow and actually treat her. And that is to prevent these sweaty, dirty lesions that go unnoticed and lead to the underestimation of the problem. So this is recognition and monitoring of infectious claw diseases in robotic milking farms can be a problem, and therefore I strongly recommend to have either regular visits and walking the pen walks actually, to look at these claw lesions in order to initiate treatment, or having computer vision cameras in the near future installed for recognizing the lesions automatically. And then I talked about the setup for cows entering the milking robots, the time spent in the waiting areas, but with particular attention to the hierarchy that the cows face in there. The waiting area is particularly scary for younger animals that range low in hierarchy. And there has to be someone who is able to either sort them or make sure that these animals don't spend too much time walking and circling for too long in the waiting areas. And then once the animals enter the robot, the setup should be, the gating should be such that upon entering, the turn is not too narrow. Upon exiting, the turn is not narrow. You should avoid these steps if you can when you pour the concrete. You should watch out for how slippery the surfaces are within the robot, because particularly heifers, upon confronting the milking robots for the first few times, they can become quite anxious in there. And there's a lot of hardware in such a robot, and you don't want them to be panicking around them. There's always the question about the fetching, the necessity for fetching cows and heifers to enter the robot. Of course, the aim is to minimize that, but if you have to fetch cows, then do it calmly, walk them quietly, don't make them turn suddenly because of that overextension of the interdigital skin, because of white line injuries, mechanical injury to the horn and claws. You want to prevent that. And part of that prevention is proper hoof trimming, functional hoof trimming. And you can see, for example, here, this cow has 2 long toes and 2 little heel horn. So if you make this cow run or break, the probability that she will bruise a white line or bruise the sole horn in the place where the typical sole ulcers emerge is very high, particularly if she's on a floor that has slatted grooves and slats perpendicular to her walking direction. Yeah. I was talking about the skid marks. If you see skid marks perpendicular to the slats, or slats perpendicular to the walking direction, as indicated by skid marks, and those skid marks become longer than the full stride of an adult person, say 1 meter or 4 feet long, you know that something is rushing these cows to walk across these slatted floors. And you want to avoid that. So this would be an opportunity to talk to your herdsman or to your producer about low-stress stockmanship. And it's really worth your time, because if you have these prolonged skid marks, you know that every time she slides across one of these slats, that's a bruise. And the cumulative bruising of claws, particularly in adult heavy cattle, will lead to mechanical injury and long-term lameness. So, and one indication that cows are being rushed across abrasive floors are these abrasions here in the heel area. This is the medial claw, this is the lateral claw. And the horn wear actually will indicate as to what is happening. Oh, I may be mistaken. This is the medial, this is the lateral. And if I see abrasion, particularly here, that's an indication that these cows are taking very narrow turns. They are breaking on these heels, and I know what I can expect from this type of abrasions, if I see them massively, are white line diseases, wall abscesses, and bruising in general. So dysfunctional horn that will lead to severe and long-term lameness, and therefore decreased well-being of the cattle, decreased longevity, increased culling rates, and increased production, and decreased economic welfare as well of the farm. What I see here on this picture as well is an indication of chronicity of digital dermatitis lesions. I'm looking at a proliferative stage here of digital dermatitis. And although this looks very innocent right now, I know that this foot is a chronic reservoir for digital dermatitis. So by just observing this and stressing the necessity to improve the observation of cows and detection of lameness and lesions in these robotic herds, I can learn a lot about what is going on in terms of stockmanship, in terms of chronicity of digital dermatitis lesions. I talked about the remote detection of lameness and claw diseases using cameras, using pen walks. We use cameras attached to the lower leg of the herdsman walking the pens, and these cameras can help with the detection of claw lesions. Think about reassessing cow traffic to avoid these long waiting periods and avoiding trauma, long-term trauma that will lead to lameness, particularly in the skittish, in the younger cows, in the low hierarchy cows. And always consider leg hygiene and environmental hygiene issues. They go very often unnoticed in particularly robotic milking herds, and that's important. And again, it's an underestimated risk, but an avoidable risk for any of these farms. If you don't monitor these robotic milking herds consistently and repeatedly, and the hoof issues, the claw issues are exacerbated and combined with over-trimming, remember the low heels, combined with long waiting periods in the holding areas, or unnoticed and untreated DD lesions, then robotic milking herds, they can turn into what I call lameness risk landscapes. And you don't want to have that, because the cattle, the cows, they have sufficient problems adapting to a new environment when they are entering the robotic milking herds. Once they are adapted, you want them as comfortable as possible, and that includes mitigating these lameness risk landscapes as much as possible. So with this, I want to distract a little bit from robotic milking herds per se and zoom in on the use of footbaths one more time. I know that this leads towards what Erica is going to tell you after my talk, but footbath and prevention of DD and infectious claw diseases in general, the idea of customized foot bathing, that applies to robotic milking herds just the same as it does in conventional milking herds. And sometimes less can be more. So if I think about foot bath in the conventional sense, and if you have your troughs away from the milking robot, you have to think about the width of these troughs, the length of them. So we recommend rather narrow, 45 centimeter narrow troughs. And we want them to be 10 to 12 feet, so up to 10 meters long actually, to have the cows walk through and have 2 dunks per claw as they walk through. You have to pay attention to these diagonal walls so that the cows cannot step on these side steps here. If you look at an older setup of a concrete foot bathing trough, you see here a cow could walk in and just sidestep the foot bath and walk out. Then there's often the question, do I need a pre-washing foot bath with only water followed by a disinfecting foot bath? We here in Wisconsin, we say we don't need the extra washing facility. We would rather have a longer foot bath and have the cows walk through and dunk their feet as many times as possible. Yeah, and then there is the aspect of hygiene of the flooring before and after the foot bath. And what that is to tell us, and this applies to robotic milking farms just the same, if at a certain number of periodically, let's say, you could scrape these floors either manually, or if there are facilities that can do that, your foot bathing efficiency is going to increase enormously. And this is a fact that is often forgotten in robotic milking herds. The foot baths are just sitting there and nobody's watching out for them. And I mentioned that we can advise you about the number of cow passes advisable for your customized version of your foot bathing strategy, and you would sample your foot bath at 0, 50, 100, and so forth number of cow passes. And once you pass beyond the 100,000 CFU per ml foot bathing fluid, that that's for us the sign it's time to change that foot bathing fluid. Or if we see an exponential increase in the number of microbes between the samples, and when that starts, we will advise, okay, you can afford to walk so many X cows through these through the same foot bathing fluid. We want to have it 6 centimeters in depth. That's about 4 inches. And in order to have the claws immersed up to the dew claws, and in order to make your best usage of that disinfecting foot bathing fluid, we advise to do this type of sampling. And from this, one of the first signs of an efficient foot bathing strategy, actually, let's say 3 to 6 weeks after you have changed something about the foot bathing strategy, the first sign of success is that the chronic lesions here, like this one, this is a chronic pedestal of proliferative tissue together with some open ulcers. But these chronic lesions, they will start shedding dead tissue in the form of flaps. So if you see the flaps falling from the chronic lesions of digital dermatitis, that means that the trend towards prevention, efficient prevention, is actually a good one. You're moving in the right direction. If you see the number of lesions that look like this, so chronic ones with new flare-ups on top of them coming back, then you're moving in the wrong direction. And using this as a rule of thumb, flaps is good news. More of the proliferative lesions, particularly the chronic flare-ups, that's bad news. If you keep that in mind, then that's an important rule of thumb to learn. Prevention of DD in heifers. Very often the heifers are housed together with dry cows and sick cows, and this is the same for robotic milking farms as it is for conventional milkers farm. So you already have the cross-contamination, cross-infection of your young stock at a very early age. If you look at the youngest towards the older, and the maximum prevalence DD pens in the pre-calving heifers, it comes this moment between no visible DD lesions or claw diseases, lameness events in general, towards having a hygiene problem because the animals are growing, they're producing more manure, and they are in rather high density in these pens, until you have a pen with a maximum prevalence of DD. And when you have identified that group of youngsters, you have to calculate about 60 to 90 days back, and this is where your prevention system should start. And a prevention system like that could include foot bathing. And if you ask me where to position a foot bath in a heifer barn, it could be here in the alleys, or if you have free stalls in there, you can create shapes of walking pathways, and you position your foot bath here at one end, make the heifers walk through one time and back. This is a way to make use of mobile foot baths. Okay, so much for the young stock. And there's always the question about topical treatments and robotic milking farms. The bottleneck, in my opinion, with robotic milking farms is the surveillance and the monitoring, the identification of animals with lamenesses and with digital dermatitis lesions in particular. We've had cameras set up in robotic milking farms where very, very capable herdsmen were at work. And these herdsmen are extremely busy. And in our 10-minute video clip, we could identify 6 severely lame cows that the herdsmen did not pay attention to because they were busy with fertility problems, with calvings, and so forth. So I would say the support of lameness and claw disease detection by means of cameras. An automated detection system must not be underestimated, particularly for the robotic milking farms. Then once identified, these animals have to be pulled. So there has to be a system and a facility in order to pull cattle for topical treatment, for inspection, for rechecking, for trimming. So, and you would think that is obvious for robotic milking farms, but it might not be. And there's an opportunity for herd health consultants to talk about how to set up hoof trimming facilities and the periodic trimming lists that need to be developed, how to set up topical treatment protocols and recheck protocols that is of particular interest in the underestimated claw problems, for the underestimated claw problems of robotic milking farms.